We're back with Kari, who found out she had ovarian cancer after an abnormality with her belly button, along with gynecologic oncologist, Dr. Beth Karlan. So Dr. Karlan, what can women do to reduce their risk of ovarian cancer?
Believe it or not, birth control pills, oral contraceptives, if taken, can reduce one's risk of ovarian cancer by 50%.
Wow.
And again, taking birth control pills before menopause, but if you take them when you're young, the risk reduction lasts for decades. I think one of the things that's important about ovarian cancer and even breast cancer is that the genes, like the BRCA genes that increase your risk, are just as likely to be inherited from your father as it is from your mother. So finding out what happens in your dad's family, his mom, his siblings, is just as important as your mom's.
And Dr. Karlan, we talk about prophylactic mastectomies in the case of BRCA positive, a strong family history of breast cancer. Is there a place for prophylactic surgeries, for example, with the fallopian tubes, ovaries, for women that are at risk?
Absolutely. Risk-reducing surgery currently, unfortunately, is the best thing we have. We wish we had a way to do that with a pill. But what we've found out most recently is that we used to always think that ovarian cancer, of course, began in the ovaries. Now we understand that one of the cells on the fallopian tube may indeed be the cell of origin that then implants, jumps onto the ovary and grows there. So after a woman's finished having her children, she may elect to have her fallopian tubes removed as a way to significantly reduce her risk of ovarian cancer. And that could be done whether you have one of these genes or not. I mean, if you're having a hysterectomy, the doctor doesn't always take out the fallopian tubes. If you decide to have a tubal ligation, have your tubes tied for contraception, rather than just tying them, remove the full fallopian tubes, and that will significantly reduce your risk of ovarian cancer.
Well, and Dr. Karlan, any side effects? I'm sure women want to know the answer to this. If you prophylactically remove some of your reproductive organs, any downside to that?
Removing the fallopian tubes will make you not able to conceive spontaneously. You still could use in vitro fertilization or other assisted reproductive technologies. Removing the ovaries before the menopause puts you into menopause. And I think that is why we are looking for better ways and looking at even removing the fallopian tubes as an interim step in someone who has a BRCA gene and may be deciding to have assisted reproductive technologies anyway. She might decide to remove her tubes in her 20s or 30s even, and then put off removing the ovaries until later. And we're doing that very frequently these days as well.
Kari, thank you so much for sharing your story, and we're just thrilled that you're doing so well, that you got through this safe and sound. Anything you want to say to the viewers before we leave you?
Yes, I do. A lot of people know about mammograms. In October, we have Breast Cancer Awareness Month and everything's pink and there's a lot of talk about it. We don't have a mammogram for our ovaries. And a lot of people wrongly assume that the Pap smear will find ovarian cancer, and it does not. So it is so important that everybody is aware of their own bodies, that they talk to their doctors, that we talk about ovarian cancer more. But even more than that, we need more research and funding so that when people are diagnosed with it, we can treat it and cure it, because all of the early detection and pre-screening and awareness isn't going to help if we don't have the medicine to improve our outcomes.
Kari, thank you for that message, and congratulations on being cancer-free. We're so happy for you. And Dr. Beth Karlan, as always, thank you for your expertise.
Great to be here. Knowledge is power.
Thank you.
That's right, Doc. Thank you so much, the two of you. And for more information on ovarian cancer, go to our website at thedoctorstv.com.